Welcome back to Small Changes, Big Shifts. I'm Dr. Michelle Robin here with my co-host Bailey Sosa. This month we've been celebrating women, and it would be a hard month to celebrate women if we weren't talking about one of the number one disease that women have. So I invited my friend Dr. Michelle Dew, a cardiologist, to add the Advent Health to share the facts. So Dr. Dew, welcome to Small Changes, Big Shifts.
Hi.
Well, first of all, why are you a cardiologist?
Oh gosh, that's a big answer for a small question. I'm a cardiologist, number one, because there are all the things that you can do for people. You can do preventative health, you can do rescue health after they've had an MI or a heart attack or something. You can do transplants, which is pretty crazy and mind blowing. But I can also talk to folks about hospice care. So it's the full continuum. So I love it. I love it because of that. And I definitely enjoy taking care of all those stages. So that's the easy answer. It's the best fit medicine for me. An interesting thing is when I was in medical school, 6 months in, Saturday morning, back in the day, your phone would ring in the house and you knew too early or too late, it would not be great news. So my mother-in-law was on the phone and she says, Michelle, I think Bruce is having a heart attack. We're going to the hospital. Can you meet us there? And I said, of course, of course. So I hung up the phone. I went to the husband. I said, baby, we got to get up now and I'm going to drive. Your mom called and she thinks your dad's having a heart attack. And so he had what I like to used to call sleep drunk, People wake up and they're like not manageable, right? Anyway, so we get in the car 10 minutes later down the road and he says, my mom's having a heart attack? And I said, okay, baby, the dad is, and this is what's happening. Anyway, this guy, this interventional cardiologist came in. He was so cool. He was like, hey, I got this. This is what I do. And I was like, oh, I like that. I like that feel. I like that everything that person is making me feel more comfortable because it was showtime. He had 100% LAD. He had actually, which I found out later, he had been real uncomfortable all night, kind of just very uncomfortable. At 6 o'clock in the morning, he says, all right, I think you should call the ambulance. They called the ambulance. He went down right when the fireman came to the door. He got shocked, defibrillated on the living room floor and, revived, took him to the hospital. He got a stent in his LAD, proximal LAD, widowmaker, and he's still alive. He's still alive. And so that really said, hey, look here. And I said, well, I'm looking. And so that was really a life-changing event for me. It's a great medicine. And I always wanted to do some sort of women's care, but I did not want to do OBGYN. It's too messy for me, too uncontrolled, if you will. And so I ended up in cardiology and I loved it. I did some research in I got a grant to study some women-specific things when I was a fellow, and it just has worked out really well. So, my big interest is women's heart disease.
Well, I love heart health, probably more the emotional heart, which she knows as we know.
Sure. Well, there's the head heart and the heart. So for sure.
So it's nice to have an expert like you around. And I want to just also acknowledge you for taking my calls on a Saturday or Sunday when I have somebody who's having an issue. I'm like, what do I do? So first of all, thank you for being one of those phone a friends when you need a cardiologist on speed dial. But I want to talk about the stats of heart health. So tell me some of the numbers or share with our listeners some of the numbers about heart health and why it's so important.
Well, so heart health is this little important sort of thing that kills more people than any other disease. Women, men, doesn't matter. Heart health. The cardiovascular system is number one cause of death in the country, in the world. Okay. 1 out of 3 women are going to die, going to pass from cardiovascular diseases. That can include hypertension, heart failure, coronary artery disease, irregular heart rhythms, valvular disease. I mean, there's a lot of things that encompass heart disease, but 1 out of 3 women. So that's a big deal. So I don't know that I can necessarily save a person from, their valve not working anymore, but I can work around it. And I tell my patients my job is to push it out. Okay. So 1 out of 3, that's a big deal. So technically there's 3 of us right here, if you think about it that way. There are certain times in a woman's life when hormones in particular are very impactful for us. When we start our periods, whether or not we become pregnant, and then, the retreat of the hormones, right? Menopause. So each one of those times.
Wait. Retreat. I've never heard it put that way. The retreat of the hormones. Mine have retreated.
No, there's a lot of, we used to call it ovarian failure.
Oh, I didn't know.
Oh, God, what a horrible phrase. It's like heart failure. Like, what? Failure. No, my ovaries didn't fail me. I always say that's retirement, right? They gave me 2 kids. They kept me balanced. They gave me good bones, all these good things. So it's ovarian retirement. Anyway, heart disease risks increase after menopause. So that's just another time when hormones are very impactful for our heart disease risk.
Well, you shared that heart disease is the number 1 killer in women. And, 1 in 3, that'd be one of us sitting right here.
Yeah.
What do you wish that all women knew about their risk?
Well, I wish that more women knew that heart disease was so impactful. No shade on the breast cancer, okay? We all know people who have been through breast cancer, who have even passed from breast cancer. But the beauty of breast cancer is 80% of breast cancer is curable, okay? And in actuality, most women who have breast cancer die from heart disease, okay? Nobody says that. And, they've done such a wonderful job of marketing. Susan G. Komen, everybody knows about the pink ribbon. That's great. But, it's a logarithmic difference of how many women die from heart disease compared to breast disease. So I wish people knew that more. And I wish also, just right on the heels of that 80% of heart disease is preventable or modifiable. Smoking, diabetes, hypertension, cholesterol. There are things you can't change, like your family history. It runs in some families. If you've already had a heart attack, we can't change that. You're at higher risk for having a heart attack. There are some things you can't change. If you smoked, well, that's in your history, but you can stop. So number 1, risk for mortality, and 80% preventable. So it's okay. There are things you can do about it. Those are my big things.
We've got a few generations sitting right here, 1 out of 3. And I don't think it's going to be one of us. It's going to be some other, the 4th person that walks in. But what are some things that generationally you could do for your heart health? Not do, test. So let's start with 20-year-olds. So should 20-year-old women be doing anything for their heart health?
That's a great perspective. I love this because I haven't necessarily thought about it this way, but I'm going to use this. So 20-year-olds, that's your decade when you figure out what you don't want, right? That's when you figure out what works for you and what is not working for me. What really needs to work then is many of the time, have a little space in that decade, right? Maybe we don't have a bunch of kids. Maybe we don't have like this career that's going, we're working, but you have space and time. So at that point, it's a great time to focus on the things that make you feel good and the things that make you are going to live good, right? I mean, if you have a drink of alcohol, that's one thing. But if you have too many drinks of alcohol and you feel really bad the next day and your body's like, what is happening? You need to identify that your body's trying to tell you something. It was in my 20s that I stopped eating, steak, because every time I ate steak, I would just feel like a rock had hit me. It takes forever to digest it. I didn't like the way it made me feel. So I think the 20s are when you really need to think about what makes me feel good. Going for a walk outside when it's sunny? Yes. Spending time with my pets? Yes. Spending time with friends who lift me up? Yes. My family who lifts me up and who supports me? Yes. Finding a significant other who is supportive of the things that I love to do. So I think the 20s is really important to start to get in touch with this body, because your body's starting to mature. When you're a teenager, so many things are changing, but 20s, things are starting to settle out into how they're going to be. So got to set a good base.
What I heard you say is you kind of get aware of your emotional heart.
Yes. Yeah, you come it because it's so crazy in your teens, right? Those hormones are going wild and it's fun and it's the best of times and the worst of times, and it changes within the same day. But yeah, in your 20s, your brain starts kind of connecting.
What about the 30s?
30s is interesting. You're kind of hitting your stride. Hopefully, you've got some stable people, stable surroundings in your life. Things are starting to, you got a track maybe in front of you. Maybe not the final track, but a place that you're going. And so now, really, this is maybe when you say, well, maybe the runs, the 5 mile runs that I don't serve me that well. What else could I do to also be healthy for my body, for my brain? It gets a little busier in the 30s a lot of times also. Maybe there's more family members coming in. And
So, what numbers should somebody in their 30s be aware of or start to get baselines of?
it's a great question. I think in our 30s, we need to be aware of what our blood pressure looks like. Hopefully, it's not even an issue, but you really need to see a healthcare provider for health once a year, at minimum twice a year if you don't have any issues. But, getting your well woman check, very important. Okay. And in that visit, they're going to check your blood pressure. As long as your blood pressure is nice and low, maybe once a year is okay. If it's a little higher, if it's 130, you need to get it rechecked. So you got to know what your blood pressure numbers are running. In some families, cholesterol runs very high. If you're in one of those families, you probably know it already by your 30s. So you should know what your cholesterol looks like. You should talk to somebody about, what do I do about this? Because a lot of our medicines for cholesterol are not okay for pregnancy, for, small children, that sort of thing. So you need to talk to somebody about it. Awareness is the first step. And, I manage people differently in their 30s than when they're in their 40s, 50s, 60s. So, having an idea what your cholesterol looks like is important, especially if you're in a family who has a lot of early heart attacks, strokes, those sorts of things. Blood sugar is incredibly important. I didn't have any diabetes in my family, so I didn't grow up with that knowledge. Diabetes is a real deal breaker. Okay. For women who have had pregnancies in their 20s or 30s, you need to make sure you understand about your blood pressure. There is something called pregnancy associated hypertension, or hypertension of pregnancy. And that is a harbinger for coronary artery disease, heart disease later in life, preeclampsia. So, this is about the time when people are having babies. So 30-year-old, you have to pay attention to pregnancy, because that can be a little sneaky, flash forward to what's coming. Also, diabetes of pregnancy. Those are all things that make you more risky later. So those are the big ones.
Well, you're making me think about some of the wisdom I wish I would have had. And the good news is I have my blood work from the time I was 22, starting chiropractic college. But I'm curious for our listeners here to be mindful about creating your own health record and really take responsibility for that knowledge, and starting to really know your numbers. And we call it body talk. Your body's always talking. Are you listening? So, if you're having, if you get hangry, maybe I have a blood sugar, or you know what, I'm really having cravings. Maybe I have a blood sugar issue. So I'm glad you brought up blood sugar. And that's a whole nother show that we have done before with Dr. Georgia Knapp. So we can put that in the show notes. Let's go to the 40s. What do I need to know in the 40s? Well, I'm not.
40s is really interesting because maybe your children are a little older. Maybe your career is sort of solidifying. Maybe you have, you're in a place where things are kind of rolling, but you know what's coming in the 40s, the numbers. And maybe the numbers kind of lie because we are cyclic creatures as a woman when we have our periods, and menopause is coming. All right. So 40s is a general age of perimenopause, right? So if the average age of menopause is 51, we can feel symptoms of perimenopause, around menopause, 7 to 10 years before the 51-year-old marker age. But remember, if 51 is average, then 45 to 55 is when most of us sort of go into menopause, which is the ovaries not making estrogen anymore. And women of color many times will go a little earlier. Many times will have more pronounced symptoms. If you've had a hysterectomy, you will have menopause about 4 years earlier than women who haven't had a hysterectomy. So in the 40s, things are going to start changing, right? So you're going to start feeling different. I never felt like this before. Why is my body shape changing? So a lot of things are happening. So it's very important to know what your blood pressure is running. It's very important to have an idea of how your cholesterol is. Need to be seeing those well women checkup visits. And, in regards to having the symptoms of perimenopause, I think there's a lot of thought about whether to check labs or not check labs. Just remember that these are cyclical, so it's hard to know where you are in the cycle. One time I was telling a woman in my clinic this, and she says, "Wait, what you're saying is I would need to get my labs checked 30 days in a row." And I said, "Well, you got it. You nailed it." Having said that, it's very expensive. There's no way insurance is going to pay for 30 days. They may not even pay for one day. So we talk a lot about symptoms. So you really need to know those basics, the blood pressure, the cholesterol, where you are. There's this thing that's fresh out in the world today. It's been around for a while. It's called LP little a or lipoprotein A. Theoretically, you check LP little a once and it shouldn't change. It's genetically determined. So it can tell you if you are at higher risk for coronary artery disease or clogs in the arteries. Now, the problem with our research is that we haven't looked at women a lot. And we haven't looked at women's LP little a before menopause, perimenopause, postmenopausal. So we don't really know if it changes in these big hormone shifts. So it's something to think about. But I think LP little a can be helpful to know how hard I need to manage someone or how strict I need to be with them when I talk about their risk factors. So that's another thing that you can kind of check in your 40s. Also, depending on your risk factors that you bring with you, your family history for early disease, if you've ever smoked, diabetes, hypertension, cholesterol, we might talk about a calcium score, which is a non-invasive test. Generally, it's $50, not covered by insurance, available at all the systems in town. And you don't have to get undressed. You just lay on the table, get in and out. The table moves you in and out of the CT scanner, and you are given a score that looks at the calcium that's in your coronary arteries. So 0 is perfect. The higher the score, the more likely you are to have a cardiac event, which can be a heart attack, heart failure, things. So that's helpful for me to kind of know where to and how to manage these folks who come in with their risk factors. So calcium score after the age of 40. I like it, not necessarily in everybody, but it's a great tool. You don't need one, but every 5 years also, you don't need the extra radiation to the chest.
Well, I love breaking it down from a generational perspective because, oftentimes and specifically with cardiology, and I'll speak for myself, you think of it as almost a specialty and almost just go when there's a problem, not necessarily for this preventative piece. So it's important for our listeners to hear what should you be looking for and maybe what are some of the signs and symptoms. So my question is, are women's symptoms truly different than men's, and what is most commonly missed?
Yeah. So to blow it up, yes, women's symptoms are generally different than men's. Any patient can have any symptom anytime. Okay. In medical school, we're trained that elephant on your chest with pain going down your left arm that's it. That's your heart. Well, I wish it was that easy. I wish it was only that, because sometimes it's the right arm, sometimes it's the right jaw, sometimes it's the shoulder blades, sometimes it's the abdomen. Sometimes you just feel fatigued. Women are classic at having some shortness of breath, like bringing the groceries in from the car, carrying things up the stairs. It's just not like it used to be. It's harder than it used to be. And, maybe I'm getting older, sure, but maybe not. We get interested when things change. So that's when you need to talk to somebody. When you notice things are different, that's when we say, oh, well, let's talk about your risk factors. Let's talk about some other things, which is so important to always be doing regular exercise, because I tell my patients that every time you work out, it's like a little mini stress test for me. And so if somebody's already working out and they have some symptoms, I say, well, we could do some things, but I don't necessarily know that this is your heart, because, you lift weights, you swim, you go for, a 2-mile walk every day. I'm not sure that this is going to be your heart, but it doesn't mean we stop thinking about what's happening with you. So yeah, shortness of breath, fatigue, pretty classic for women with heart disease.
I think we could talk for about 4 or 5 hours on this subject, but in light of time, let's cut a couple more questions here. How does stress play into heart disease?
Stress is interesting. We all have stress. It's called life. And we are able to handle our stressors and our life better at sometimes because we're human. Every day you're a better or worse human. Okay, so that sort of jumps around a little bit. Stress itself increases cortisol, which is this stress hormone. High cortisol levels, lots of inflammation happen. Inflammation leads to all sorts of nasty little downstream effects, higher blood pressure. So stress is a little harder to put your finger on, but it definitely can add to risks. And then, of course, there's a stress cardiomyopathy, also known as Takotsubo. We see it more often in women than men, but we see men also with Takotsubo. Usually it'll happen in their 40s, maybe 50s, after a big life event. Someone dies, there's big things happening with the job. It's a cumulative effect, and it can be devastating. It can be catastrophic. So stress is a big deal, big deal. You always ask these people who were fine last week, and then they come in and their heart is barely squeezing. You say, tell me about what happened. How'd you get here? And they start telling you these stories that you couldn't make up. You couldn't write these. Yeah.
I think this is such perfect timing too in the month of May as we're talking about women's health and thinking about the prevention side. And I think that's one of the things that's attracted me to Small Changes. The work that we're doing at Small Changes and at Your Wellness Connection is that preventative piece. It's getting into rooms where people think they can only go when they're sick and then reminding them that there are so many ways to take care of yourself before you even get to that point. So for those our listeners out there who are curious about better ways to take care of their heart, what's a non-negotiable for you that you would recommend to?
Okay. The biggest non-negotiable, the hard stop, is smoking. Okay? No, please stop. Just stop. These lungs are these beautiful pink spongy material organs that were created to breathe this clear, transparent, invisible air. And just think about what you see coming out of people's mouths when they smoke. That is a deal breaker. I always talk about smoking, and it seems so obvious, but people still smoke. And vaping doesn't count because I know that the vapor that comes out is not as impactful feeling if you're in the same room. But my question is, do you really believe the companies that say it's better for you? No, we've seen lots of vaping lung disease that's irreversible. So putting the stuff in your lungs is a hard stop. No, cannot go there.
I'm glad you brought up the vaping piece too, because being in my 20s, it's all over. And I've got a brother in high school, and it's mind-blowing to me the access that these kids have and how early they're getting their hands on it. And I hope our listeners really hear Dr. Du when she says that of it is impacting you way more than you think. And it's important to pay attention to it even while you're young, because while you might not feel the effects of it now, you will feel it down the road. And it's just not worth it. And so oftentimes it's hard to hear the things that you can't do. What are some things that people can do for their heart health?
Thank you. Thank you. I love giving the positives of things that you can do to affect your heart. Just go for a walk. That's it. It's very easy. Start moving your body. Your body loves to move. And I tell my patients, you move today, how you want to move in 5 years. So think about that.
Dr. Michelle, this has been an informative show, and I want to just thank you for the way you're showing up in our community and around the world and really trying to educate women about how to really take better care of their physical heart as well as their emotional heart. I love the way you started with the 20s because that really tied into my lane. So thank you for getting into my lane over here and for saying yes. So to all of our listeners, know your numbers and find a good doctor that you could trust and that will help you live the life you want to live. And most of all, take responsibility for your own well-being. And you deserve to be happy. You deserve to be well. And I really think that the quote that comes to my mind is life is really simple when you say stop making it complicated. I think that's so true with well-being. It doesn't have to be complicated. Once again, know your numbers, check on your sisters, check on their friends. Happy May, happy Heart Month. Speaking of heart, I know we're not in February, but I'm sending y'all heart hugs, and we'll chat real soon. Join us next week as we continue our heart series. Blessings to all of you.